But you know the memes right now. You fall out of a plane without a parachute, cause of death, COVID-19. You get shot in the head, COVID-19 killed you. You have a heart attack, COVID-19. They're putting the cause of death as COVID-19 for almost everything right now. And we've heard this type of information before. Some would call it conspiratorial, some would say it's rhetoric. But look, right now, you would have to be blind and deaf to not recognize that what is happening is not normal and is not justified.
But there's also the possibility it came accidentally from a laboratory. The Wuhan Institute of Virology is just a few miles away, and it's thought to have conducted research into diseases in bats.
In 1918, after the biggest pandemic, the Spanish flu pandemic of 1918, Steiner was asked, what was this all about? And he said, well, viruses are simply excretions of a toxic cell. Viruses are pieces of DNA or RNA with a few other proteins. They bud out from the cell. They happen when the cell is poisoned. They are not the cause of anything. And the cells get poisoned. They try to purify themselves by excreting debris, which we call viruses. If you go to the current theory of viruses called exosomes, and the latest head of the NIH giving a talk on the complexity of viruses, you will see this is perfectly in line with the current thinking on what a virus really is.
The virus is fully an exosome in every sense of the word. You can be taken from your home and placed in a detention centre based on that 80% false positive. Very scary. So let's go through what that test is.
Authorities may have to enter people's homes and remove family members, presumably by force.
In most parts of the world, due to lockdown, most of the transmission that's actually happening in many countries now is happening in the household, at family level. In some senses, transmission has been taken off the streets and pushed back into family units. Now we need to go and look in families to find those people who may be sick and remove them and isolate them in a safe and dignified manner.
Remove them and isolate them in a safe and dignified manner.
So exosomes are part of your immune system. And exosomes and virus, remember, Dr. James Hidreth, an absolute expert in virology, said that they're the same.
When a surgeon wears a mask, and when a nurse wears a mask with a critical patient, we're not wearing that mask to protect ourselves. When you're doing open heart surgery, you're replacing a knee, or you're doing some kind of hernia repair, you're wearing the mask so you don't drool, you don't spit, you don't cough, you don't sneeze into that open surgical field, so because you're keeping it sterile. All right. Now we come to the United States and we come to the current issue. Everything is misinformation. All right. We know that stress increases the cortisol, which is the stress hormone, which decreases the immune system. So when you scare people, tell them to stay home, you suppress their immune system because you're scaring them. You further suppress them because economic issues, they're stressed out. Now you tell them wear a face mask. What are you doing when you're wearing a face mask? A face mask reduces the amount of oxygen coming in. So now your body's in a chronic state of stress. And that face mask is obstructing airway. They're pushing this agenda, and it's an agenda to make people weaker, to make them more susceptible. The face mask then also prevents, when your body's being stressed out and you're not getting enough oxygen, it then creates other issues. You remember they said don't touch your face and don't okay, well, if you're sweating and you've got face mask, don't you think people are going to be pushing it around? On top of that, when you have this release of viruses, because viruses live inside our cells, when I say live, they're not living, but when they're released, and you're wearing a face mask, you're preventing the ability to, you're actually stressing the body out and increasing the viral activation, if you will. All right, so you're actually increasing the susceptibility of the individual stress-wise and increasing the viral load. So tell me, if they really want to help people, why are they telling people that they should be wearing masks? It's completely preposterous. The world needs to wake up and understand that what's happening right now is an illusion, and it's going to mandate other things coming down, which is include